Hello, everyone. Thank you for joining us for our webinar. My name is Emily. I'm a clinical assistant manager from Razor Optech. Today, we honor to have Dr. Han-Mi Jung, who will be discussing her personal experiences and treatment approaches. Today, we'll be presenting about using Helios 785 Pico to treat various pigmentation. There will be a question and answer session after the presentation. So if you have any question, please use the question tab during the presentation. I'd like to introduce today's distinguished presenter, Dr. Han-Mi Jung. She graduated from the College of Medicine, the Catholic University of Korea. She also obtained the doctorate degree, Department of Dermatology at the same university. She was clinical instructor, the Department of the Dermatology, St. Vincent Hospital, the Catholic University. She was a former director of Husuhu Skin Clinic, Dongtan, which is located in South Korea. She is dermatology representative director of Hill House Skin Clinic, also based in South Korea. Additionally, Dr. Jung is a member of Korean Society of Dermatology, Korean Atopic Dermatitis Association, Korean Psoriasis Society, Korean Hair Research Society, Korean Society of the Aesthetic Surgery, and Korean Acne Society. Please give a warm welcome to Dr. Jung.
Hello, nice to meet you. I'm Han-Mi Jung from Korea. Thank you for introducing me. And today I'm going to tell you how I actually use Helios 785 Pico laser clinically on my patients. Helios 785 Pico is a Q-switch NDF laser with a wavelength of 1064 and 532. In particular, it has a laser with a wavelength of 785 nanometer of 600 picosecond. Helios 785 has multiple laser modes. In real twin pulse mode, displays two identical pulses in one flash lamp operation. In FR mode, a laser beam of quasi-long pulse of 300 microsecond is emitted, so thermal effect is accompanied with stimulated skin cell regeneration. Fractional handpieces of Helios emit DOE beams. In particular, as shown in this picture, in 785 fractional, the penetration depth can be adjusted. So you can adjust the penetration depth according to the depth of the target lesion or the depth of the target lesion. Compared to other picosecond laser devices with similar wavelengths, it has the highest peak power of 0.33 gigawatts and has 3 different handpieces. So it can be used in a variety of cases. Then why is the 785 nanometer wavelength? Let's take a look. In this absorption curve, 785 is located here. So the melanin absorption is this label, and the oxyhemoglobin absorption is this label. When the melanin absorption of 532 is 100%, the absorption rate of 1064 is 9%, and that of 785 is 26%. So it has a stronger melanin absorption than 1064. That's why it shows faster result than 1064. And because the 785 is longer than 532, the penetration depth is deeper, and therefore it can reach even deeper pigmented lesions. Furthermore, 785 is safer for darker skin because its melanin absorption rate is much lower than 532. Looking at the melanosome to blood absorption ratio, 730 is 30% higher than 785. So 730 may be better when treating light-colored pigments, and 785 may be better and safer for darker skin type. And this is my application of Paleo 785 Pico. I use it for skin brightening, and also I can get skin rejuvenation. And I use it for solar lentigo, which is remnant pigmentation after picosecond laser 532, and for multiple antigens and capillary macule, PIH, and melasma. And the following shows how I use handpieces of Helios. For the laser toning and skin brightening and melasma, I usually pick up 1064 collimator and 785 fractional occasionally, and 785 collimator also. For solar lentigo, Pico laser 532 is my first choice, and then the remaining pigment is treated with 1064 zoom or 785 zoom. For both multiple antigens, my choice is 1064 zoom, combination with 785 zoom or fractional. And for capillary macule and PIH, my choice is 1064 zoom handpiece. So let's move on to the clinical cases I treated with Helios 785 Pico. First is skin brightening. As you know, for skin brightening, laser toning is done with 1064 collimator. Usually, energy is used at the following intensity, and when I using RTP mode, I use maximum energy for each diameter size. In this case, the skin color is bright, so the fluence is slightly raised than other patients. After low fluence laser toning was done on the entire face, and on the darker pigments, higher fluence laser toning was done. After she went on a summer vacation and her skin got tanned, so she got 2 sessions of 785 fractional and 2 sessions of 785 collimator weekly. So after 4 treatments, her skin brightening was as follows. In this case, firstly, IPL and long-burst KTP 532 and Piccolo 532 are used for darker pigments like this. And after that, from here, 10 sessions of 1064 laser toning only was done, and the skin brightening was as follows. Next is multiple antigens and miscellaneous pigments. For those multiple pigments of light brown color, at first I used the Piccolo 532, but there was no improvement. So I thought that the depth of the pigment was deeper than that could be reached with 532. So I chose 785 zoom with the strength enough to form a minor crust, and then the lesion showed a lot of improvement after a single treatment. Next case, diffuse light-colored antigens on both malar areas and cheeks. Usually, these light-colored pigments take too long time to treat with 1064 and have a high risk of PIH to treat with 532. So I chose 785. And the following improvement was seen after 5 treatments with a strength enough to form a minor crust after treatment. I used 785 zoom handpiece also. Below are pictures before and after 10 treatments. Using 785 seems to be able to treat this light brown colored pigment in a relatively short time without side effects. Similar to the previous case, this case also has diffuse antigens on both malar areas and cheeks, and it seems that abdomen is also mixed. I treated her with 785 zoom handpiece and 1064 zoom laser toning combination, and the following improvement was seen after treatment, after 10 sessions. Likewise, I think that using 785 laser toning combination with 1064 results in faster improvement and fewer side effects. The next case is similar with the previous cases, multiple pigments on her malar area. And I treated it with 785 zoom handpiece plus 1064 laser toning. And after 10 treatments, the following the result was seen as here. And from here, I added 785 fractional and 1064 laser toning. And after that, the lesion was cleared. Before and after picture. And next is melasma. In melasma, the main treatment is obviously 1064 toning, I think that, but you can get better results and rejuvenation effect also with 785 fractional. In this case, at first I used one session of IPL, and after that I did a 1064 laser toning and combination with 785 fractional. And after 5 sessions, the result was here. And she had aggravated melasma after laser treatment at another clinic. And in my clinic, after 10 sessions of 785 fractional and 1064 laser toning, only that laser, her skin was improved as shown below. And another, next is solar lentigo. I usually choose Piccolo 532 to treat solar lentigo, but I'm afraid to use 532 in patients with melasma like the following patient because of the risk of PIH. So in this case, I treated the solar lentigo with 785 zoom, and after 2 weeks, it was removed relatively well with no PIH or erythema. However, the lentigo lesion on the opposite side of the face was treated with 670 nanometer pico laser, which, unlike the 785, left a long-lasting erythema and PIH. So from this case, I realized that 785 is safer than 670 for melasma patients. In fact, the most common use is to combine the 1064 laser toning with the 785. I treated this case with Piccolo Premium 532 zoom, and after that, Helios 785 zoom and 1064 zoom. We can see that there is a significant improvement after 7 laser treatments. The same patient. And she got 1 session of IPL and Pico 532. And after that, the laser toning with 1064 only, 5 sessions. And this patient improved until this second photo after using a combination of various lasers, but there wasn't much improvement after 7 sessions of laser toning. So I treated her with 785 combination from here, and the following improvement and a rejuvenation effect were also achieved. Likewise, when 1064 toning was no longer effective like here, the combination of 785 was able to achieve additional improvement and rejuvenation. From here, I added 785 fractional and collimator, and the following improvement was seen. Same patient. And in this case, after 670 pico laser for solar lentigo, and there was PIH and remaining pigments. So I treated those remaining pigments with Helios laser. I used 1064 with 785 fractional, and after 8 sessions, pigment was much improved. Same patient. And she showed such little improvement after IPL and 12 treatments of 1064 laser toning only. So from here, I added 785 fractional and collimator, and additional improvement and rejuvenation was seen. In cases like this, I find that combining laser toning with 785 toning shows better and faster results. Next is cafe au lait macule. In Korea, usually cafe au lait macule is treated with high fluence laser toning. On average, after about 30 to 50 treatments, the following improvements are seen. Depending on the size, location, and shape of the lesion, the number of required treatments varies. In this case, I treated her with 1064 zoom handpiece with following energy, and after 30 treatments, the lesion was completely disappeared. And next is PIH. As you know, it's easy to treat PIH. At first, we should treat the inflammation that caused PIH. In this case, it was folliculitis. And then after 10 to 20 sessions of 1064 laser toning, the lesion is greatly improved. Yeah, as I summarize, I think Helios 785 pico laser is good for multiple light lentigens, especially when you use 785 zoom handpiece. And using 1064 laser toning and 785 together, it is good for solar lentigo. And it is also good for adjuvant treatment on remaining pigments after IPL or picosecond laser. And for melasma patient, if you use 1064 laser toning in combination with 785, you can get additional adjuvant rejuvenation effect. Yes, thank you for listening.
Thank you for sharing clinical information and experience with Helios 785 Pico. It was so informative presentation. I will go ahead with question and answer session. So once again, if you have any question, please use the question tab on the screen. Yes, first question is, when do you use 785 instead of 1064 Pico?
Usually I like to combine 1064 and 785, but the pigment is light colored, so I worried about taking too long time to treat with 1064. I picked the 785 and I use the 785 zoom, and I make a little bit whitening after the treatment.
Next question is, what is the difference fractional collimator 785? When to choose using fractional or collimator? Also, what is the minimal session to see improvements?
Regarding laser toning, I think there isn't any much difference between 785 fractional and collimator, but I think that as you did see in the picture of DOE beam, when we use 785 fractional, I think that we can get additional rejuvenation effect adjuvant rejuvenation effect. So when I combine the 785, I usually pick 785 fractional than collimator. And our next question is, what is the minimal session to see improvement? I think that when I tried just 785 only, not 1064, I saw that the improvement was seen after 2 or 3 sessions.
Next question is, how long does it interval for each session, especially on PI-AIDS and melasma?
Usually, the interval of treatment is 1 or 2 weeks.
Okay. Next question is, which synthesis to use for rejuvenation? Razor toning 1064 or fractional 785?
In case of 1064, I usually pick the collimator, and for the rejuvenation effect, I also pick the picosecond 1064 fractional, and for 785 fractional, sorry. Usually I combine those two wavelengths, 1064 and 785 fractional. I like the combination.
Okay, next one is, after the pico, have acne, how to management, and how long it will disappear?
I'm not sure that you mean that can I treat acne lesion with pico? Is it right?
Can you write more detail about it,
Please.
Yeah. Next one is the collimator 0.3 millisecond like Hello 3 and set to 8 millimeters spot size? I was thinking this may be the difference.
Millijoule. You mean 0.3 millijoule?
Could you write down more detail about it? We couldn't understand what you mean. So I will go next question. How many passes do you complete in one session for melasma 1064, 785 to see a result?
Usually, when I combine that, for 1064 about 2,000 passes, two passes and 2,000 counts, beam counts, and for 785 usually I do just 1,000 counts, just one pass.
Next one is how to manage acne eruption from pico razor.
I didn't experience any acne eruption after pico laser. Have you? after pico laser, fractional pico laser, there is sometimes there is very light folliculitis, but not acne. And in case of folliculitis, just just say them to have a point any emollient, or I prescribe them antibiotics.
Okay, next one is, what is the best combination handpiece if you want to see instant growing? Combination with FR or 1064 or 785 or single treatments?
I think in my case, the best combination is 1064 collimator plus 785 frictional. In my case, it was the best result.
Next question is 785 pico as good as 1064 pico for most condition, or which condition is 1064 pico more superior?
I think there is that much difference, but in case of melasma, when I use the 785 fractional with big energy, there was some cases worsening of the melasma. So in case of severe melasma patient, I think the 1064 is more safer than 785.
Next one is, do you suggest to always use mix of collimator and fractional handpiece to see results?
Yes, in my case, I think that the combination is always better than a single wavelength.
Thank you. Next one is, for Sorrel Lentigo, do you have better results with 785 or 532? How do you treat your Sorrel Lentigo cases?
In most cases, 532 is much better than 785. In most cases means there is not much high risk of PIH. But in case of a patient with high risk of PIH, like as you see in those pictures with melasma patient, or one who has a darker skin, or when the lesion is located in lower face, which is very high area of PIH, I think in that case, 785 is better than 532. But except that case, in most cases, I think 532 is much better result than 785.
Okay, next one is, what is pre and post treatment precaution to take a better result?
I think that the most important thing is to tell the patient that apply the sunscreen. And in my clinic, after the laser treatment, we always do the skincare for skin brightening and hydration. I think skincare after the laser is also important.
Okay, next question is, do you see better results with melasma on pico or Q-switch? So is there more risk with Q-switch or pico?
In my experience, I think melasma is as you know, is very tricky, but I think the result of the treatment is better when I use Q-switch laser than pico laser only. So I like to, 1064 pico. Also, usually I pick the Q-switch laser like Helios, and yes.
Thank you. If anyone have other questions, thank you, Dr. Jung. Thank you for joining us today in this important event. You're such a big help. Thank you for everybody who participated. If you have any question, feel free to contact Razor Optech. Once again, thank you for attending and have a great day.